Amy, or would you please call the roll?
Sure. Hannah Eisner,
Here.
Corey Tello,
Here.
and Susan Schaefer.
Here.
And then just so you guys know, Julie is taking minutes, but she doesn't have the capacity to be able to talk. And then Taylor Davis is the behavioral health specialist.
Morning, Taylor. And yeah, thanks for explaining that. There's another Julie Sullivan who might have had an interest in who's with the League of Women Voters. So I just, when I saw the name, I wondered if somebody had comments is all. So
That makes sense.
So since Judy is not here and our first topic was mental health budget, I know she had interest in that and was also making some calls. So if anybody's okay with moving forward, we'll just go to the second item on the agenda, which is the quarterly reports. Anybody object to taking that up first and giving Judy time to get here? So I don't know if anybody has specific questions. Amy, whether you want to, you've given us the reports. I don't think that you need to go through each one of them individually. Thank you for getting that done. It's helpful to me, at least, to see them and get a chance to look at them. I don't know, does anybody have any comments or questions about the reports? Speak up if yes, Corey.
Well, I always want as much information as possible about waiting lists and what they're doing, what's the interim supports that are offered to people on the waiting list, and then what they're doing to move people off the waiting list. And I know a lot of agencies say we don't have a waiting list, but it's not because they maybe don't actually have people that are in need of service, but aren't. I mean, sometimes they just choose not to formally create a waiting list, even though they may have people that are not able to get into services. And so I'm trying to figure out how we can tease out, that so if there was a formal waiting list, how many people would be on it? I mean, I almost feel like that's a question I would like to know. And especially as, people have resumed back in person, and certainly this I think applies more than just schools, but certainly it sounds like schools have seen, as the kids have come back from remote learning and the teachers are now laying eyes on them physically, there have been more referrals, and that certainly was reflected in these reports. And so I just think we, moving forward, knowing that we may be seeing that in multiple places, how we're going to address those needs that may be underserved right now, because there's either staff shortages. I mean, we also are hearing that it's very, very hard to find master's level clinicians, and therefore some programs are, struggling to, even if they have the money to hire people, they can't find them. So that's a concern. And I just want to figure out what our role needs to be in that process.
Corey, are you suggesting then it would seem like as a part of the quarterly reporting, we could just specifically ask each agency whether they have a waiting list? Yes, no, how many average or over the quarter remain on the waiting list? And then thirdly, how they propose to address the need.
Yeah, I think there's some legalities attached to that, and maybe, I don't know whether that's something that we need to verify, but I think sometimes, and this is purely me speculating, but I think sometimes agencies are reluctant to say we have a formal waiting list, because then if someone was on that waiting list and something awful happened to that person, while they were not being served but were on a waiting list, does the agency then have liability for that person? And I think sometimes that enters into this, and I feel like maybe we need to know more about that before we make we formally put it in some document and we formally request it. Does that make sense to anybody? I mean, I think there's some liabilities involved in that. Unless you can, yeah, so I'm not sure how to deal with that.
I want to interrupt. I don't know if anyone can hear me. This is Samantha.
Thank
I
you,
am
Sam.
I am listening on the call. I'm having some trouble with my computer. I'm trying to log in. But I will take note of that question if that's something that you want me to look up.
That would be fabulous.
Thanks. I know that one of the reports this month from the schools indicated they were maintaining a waiting list. So I would say, at least from our end, we are within our rights to request that information. I appreciate the sensitivity you're showing, Corey, to the fact that we don't want to put our
Right.
agency in any difficult position. But I think if that is the case, then I don't see how we'll get that information. So unless
No,
we,
I know, that's why it's really one of those catch-22s. And the thing is, I think our county, our community has an obligation to figure out where the underserved people are and figure out what we're going to do about it. So it kind of raises a whole larger issue of, how are we addressing, identifying underserved people just in general.
I just
And-
wanted to
and, yeah,
say
we could
too that
we could talk about this for a year. So I'm not trying to get us off track. I'm just throwing that out there about how do we do that. And I'm particularly worried because if we continue to have a shortage of master's level clinicians, I worry about, are we going to continue to have trouble meeting needs, even if funding exists to hire people?
I just wanted to quickly add to some of them. So some do a waiting list if it's a very specific program. And some of them, I think that they don't do a waiting list because they refer them to somewhere else.
Right.
Instead of like having, I think that's kind of just a thought, like instead of putting them on their waiting list, if they're interested in a program that's within the community, like counseling or whatever, within the community, but they can't take them and maybe they could get it from somewhere else, then they may refer them to the other place instead of just having them like sit and wait.
Which is great, but then do we know that when they're referred to, quote, the other place, quote,
Mhm.
does that place pick them up? So I mean, again, I'm trying to figure out what we ask and how we ask it so that it's not just an exercise, but it actually yields true demographic information about what are the mental health needs in our county that are not being met.
I think also what we have is we have requests for funding, which, and then we have reports that are coming out to us based on those requests for funding. And if you look at the metrics with which they provide us, they almost uniformly indicate that they're meeting their metrics with the funds that we're giving them. That doesn't mean that the funds we give them adequately fund the program to serve all the needs. So I think your question as to waiting lists or whatever, Corey, maybe could be asked in a different way of, to what degree do you, and again, we don't want to open the door to saying, well, we're inviting you to ask us for more and more and more money. But it is something to get to, which is the program is structured because of either funding or staffing, simply can't address the complete need. We aren't keeping a waiting list per se because we don't have the resources to address that. So maybe that's something at a year end time with our agencies, we just ask for some feedback and let them tell us, yeah, I can't. I mean, we've gotten information recently from CHS about them trying to refer to primary care doctors, for example, as a way of addressing some needs. So these other agencies may have ways. I mean, I don't know that we'll ever know exactly what happens. Unfortunately, there are still people who disappear, and we do our best to try to find them and scoop them back up and put them in a basket.
Yeah. Well, thank you, Sam. If Samantha can, research a little bit about what are the liabilities or legalities attached to having a waiting list for an agency, that would be helpful. And then I think, Hannah, your point is good. If we can just figure out how to capture, for people that you are not able to directly serve, what's being done in an interim basis to support them. I mean, I guess if we can just throw that into every quarterly report or something like that, and maybe just what are interim supports. But Yeah, because I'm worried about what's going to happen across the land here.
Susan, do you have any comments or questions on the quarterly reports?
I did have a question on the one, Amy, that talked about it's Irving and Sheridan, the embedded school program. And they put in the narrative that they currently have 2 therapists, and the goal starting the next school year will be for 1 therapist to be embedded full-time within each school. That was a little unclear, so that means each of the schools will have a full-time therapist. Is that what they mean by that? It was just
Yeah, it's actually kind of, so that is new this year, and it's actually kind of cool. So they have 2 therapists, they're twin sisters, and they are kind of like, yeah, so they don't even really, like, they have to wear name tags, they know which one it is. But right now they have kind of split where with Irving and Sheridan that they each kind of have some students from each school. So there are 2 therapists right now, but moving into next year, they just want 1 therapist to be embedded in Irving and 1 in Sheridan instead of them kind of having this split caseload. So it's still the same number of therapists. It's just twin A will have this school and twin B will have the other school.
Okay, so they have been all, so far this year, they have had 2 therapists already in place, 2 full-time therapists already in place in those schools?
Yes, but
Okay.
and I would also say too, because like that overall youth outreach program with CHS, because they had like a really flux of referrals this recently, that they've had to have some of those therapists also cover different kids that needed to be seen, especially high risk kids. But yes, they have 2 full-time therapists, and they're hoping, especially once they get fully staffed, it would be 1 therapist for Irving and 1 therapist for Sheridan.
Super. And still for the $20,000 though, they're not asking, they're able to do that within the 20. That's great. And then I had a question about Olympia. There was quite a drop from the previous year. I mean, they served only 31 compared to 45 and 42 in Q1s for the last 2 years. And so has Olympia been in person most of the time?
So with Olympia, yeah, so the January through March for that first quarter was definitely a challenge with all of the school districts. So Olympia has mainly been in person this school year, but with the holidays, which would have fed Q1, so like November, December holidays, that would have fed new referrals into Q1. They did go,
okay.
So they had some like outbreaks where they had to do a short period of remote, but for the most part, they've been in person. And the other thing too with Olympia, and I don't think I noted it, was that they had 1 therapist like this since the pilot up until now, and that therapist left like January or February. And so then that with the shortage, and then they do have a new embedded therapist in Olympia now that's going really well. But I'm assuming too, just with that transition of the therapist leaving, the new therapist coming on, and then just the influx of referrals all together, the program affected Olympia's numbers. But based on my conversation with them in May, I would suspect that their Q2 numbers would definitely have increased. They were getting more stability with the new embedded therapist, and CHS was hiring more therapists to be able to help with the influx.
Okay, thank you. That makes sense that there were some dynamics that impacted referral process. Okay. I was very happy to see the graph that was provided for my mobile crisis to show the hospitalization rate, and that it's gone down a bit.
Well, and it's starting to,
thank goodness.
It's starting to go up a little. Like it went down,
Right.
and now they're seeing it is starting to lower, more folks are needing hospitalized.
And what do they attribute that to? That people are feeling like they're forced back into situations they're not ready for yet, or there's such lingering trauma from the just lingering trauma.
the current rise in the number of folks needing hospitalized, I think they're contributing a lot of that to the stressors of the pandemic. And so, like, if you also think like a lot of people are struggling right now, and we had so much time shut down where people were like not going out and getting help. And so there wasn't that really ability to be preventive. And so then now people are just kind of getting more to that point where it's not safe and to not be hospitalized. And so they think just the challenges overall with mental health and the pandemic, it has been part of the increase of hospitalizations.
Okay. And let's see, I was thinking there was one other thing I had, I think. And what do we, Pat's comments, 211's comment about there's the new program that they think is going to impact the number of calls they may get. Do we need to get more information or just track that and see how we're doing on that? They made the comment that PATH may also have to invest in more paid staff to successfully manage the call center because, well, they said let's see, because there's legislation that requires all telephone providers to be able to utilize 988 as a 3-digit phone number for individuals experiencing a crisis and or thoughts of suicide. They reported they think the ease of that may increase their call volume. And that has to be in place by July 16th, 2022, not this July, 2022. So I guess that gives them a little time to gear up for that. I'm sorry, I was thinking it was 21. So that we've got a year to work on that, but we do definitely have to pay attention to that. And I worry too that, will they continue to get volunteers? It sounds like that's becoming, it sounds like they have to move to a more paid staff than they've been accustomed to.
Yeah, Corey, so those were kind of like two separate things. And so the one is just, there's been a lot of challenges with volunteers and getting that retention and with especially because of the pandemic. And they're finding that they may end up to have like stability within that program. They may have to have more paid staff, still volunteers, but have more paid staff. And then the other piece of it too is just there's more information coming out with the 3-digit, the 988. And so they are, right, they have the year, but they would answer that call line for McLean County. And they answer it now, but it's the full phone number for most. And so they're just expecting with like the ease of that 3-digit that may be an increase, but yeah, we won't know more about that until next year.
Okay, all right. And I'm on a roll here as always. So is this the time we want to talk about Too Good for Drugs, the narrative that Amy included? Okay, all right. Then I think I had one more question about an outcome statistic, but right now I cannot find my little highlight. So I think I'm done for now. Thank you for your patience with me.
That's fine. That's what we're here for, Corey, and you always do a good job of reviewing the reports. So appreciate your careful reading and good questions. Susan, did you have anything on the reports that you wanted to ask or comments? Okay. I had a couple things more general. The school reports are interesting to me because they did seem to kind of provide different information and insights across schools. And I guess my comment on that is that, does that really make it drive home the idea that it would be helpful to have a more centralized approach so that the things that are happening in those individual schools can be more shared across schools or techniques? I mean, this was a pilot program and we did some evaluation of it. And of course, as the programs now diverge, it's very difficult to now go back and say, does this work or not? Because they're not following the same model. So I just thought, great that they're out there, but maybe taking those all together, it makes sense to kind of continue our discussions with finding a way to more centralize the funding and the money to kind of get a more uniform program out there and to get the benefit of what schools are finding works and doesn't work. If not a centralized method, and at some point bringing all those together to say, here's what's happening, try this. I mean, there was notes of dedicated space in schools, which seemed to help make the program stronger in those schools. I mean, just little things like that. So,
I think the key to those school, first of all, I think it gets more centralized when one agency is delivering the service. And I don't know that that's what we want to, I don't think that's what we were going for ever, but it does. I mean, I think sometimes what happens is the agency who is supplying the therapist has a lot to do with what
yeah,
happened. Because
we have one agency essentially doing it now for the most part, and we see the reports have very different notes in them. So I'm not
But
sure
some
you
of that is just the nature. Some of that is because of who in the actual physical school building is in charge and like driving it, staying engaged with it, keeping it in front of staff, constantly monitoring it. I mean, to me, it's that piece of who is that overseer at the school level. And so you're right, Hannah. I think that, and Susan has forever talked about an implementation guide, a blueprint, which we have said over and over we need to do. I think we still have to say that needs to be created so that there are, some, so it's there's a guidance document that says, here are the critical components that need to be included. Here are critical time frames within the year when different things need to be looked at and addressed. I mean, and believe me, there's tons of stuff out there already that could be pulled in to do that.
So we're down the road several years with this project, so it's probably good to take stock and
Right.
um,
But I also say, Amy's point about when you get a turnover and you get a new staff person in there, that definitely slows it down because it's all about, you have to build trust again of the school staff to want to refer to a new person and the new person to know who to go to push for referrals. And so that whenever there's turnover, that creates, that you lose momentum. It's, and it happens. Yeah.
and just one point of clarification, Amy, on the Sheridan Irving, one of the things that we've noted in those two schools in particular is that given the demographics, they've had those programs funded by Medicaid over the years. The two counselors that are now, they're the twins. Are they 100% funded? They couldn't be by our 20,000. So they must be also seeing some of the Medicaid kids. Are they?
So with the embedded with all of the embedded programs, it's a mixture of with that therapist with some Medicaid, some private, some no insurance. But as far as it sounds like you're talking about with the budget, does it have both of the therapists on the budget?
No. I just want to clarify that the individuals who are working there are seeing non-insurance kids, our kids, and then the others that may be Medicaid.
Yep.
So,
Both. It's the blended.
and then the other two comments I had was, I was interested to see that the mobile crisis, when we had the year-to-year comparison, which thank you for pulling that in, wasn't looking that different. And I was completely shocked by that. I thought, now maybe that's the effect of having the triage center open and other outlets, or maybe Path with the texting has pulled some of the people in that can be resolved without calling mobile crisis. But I thought, wow, that was unexpected. And Path, of course, we're higher, so maybe you're seeing it there.
Yep, I agree. And this pandemic has been so weird where there's this time where people weren't reaching out because they were just so scared of being around other people, and then it's kind of fluctuated. And so I think, Hannah, I was also had the same thoughts as you, but I think it will be interesting as we move forward how that number is affected as more people start to reach out.
Yeah. And overall, I think it was nice to see the programs continuing so well through the crisis. So with the numbers. So
I think
last
that's
question.
a great point, Hannah. They should really be commended. I can't imagine how difficult that really was. if I did find my question about the percentages on the outcome data, could I go ahead and ask that?
Let me just finish what I wanted, Corey, and then you can hold that thought for a minute. The third thing was in the psych, as is stated in there, and kind of, oh boy, we're informed of Dr. Abuelita's retirement. That's a whole discussion. That's not what I'm going down today, but they did submit a budget to us with their funding request. I think that contains some money for the psychiatrist. So just a question, probably / comment that we may want to go back to them and ask if they intend to submit a revised budget to reflect changes with his retirement. Because they said they're going to have an MD, maybe that money goes. So just anything that we should know budget wise as a result of that.
So I was thinking with the submit, and we did kind of start that conversation. If they submit the revised budget, that money that is in the budget now for staff for Dr. Adelita, if then I'm assuming from our conversation that revised budget would be for the money to go to the 2 APNs that they're
Be my
putting.
guess.
Okay.
I mean, let them show us,
Work
but
on doing that.
yeah, okay. And that was it. So Corey, if you still
Sorry.
remember.
No, that's a great point you just made. So yeah, it's good to get more information, but I was encouraged that they seem like they've got a transition plan in place, and it sounds like they've got a doctor that they believe can fill that role that Dr. Abuelita filled. I hope that's true. So that we do need to know for sure whether that person does meet the credentialing that's necessary to oversee the APN. So, but obviously they know they should be paying attention to that.
Is an APN has to have a supervising physician, right? So,
Yes.
so they have to do that. Yeah.
Right.
So,
Yeah, so they're looking at doing what probably a lot of agencies do with to meet that requirement. They have and I'm not 100% sure if I'm saying this correctly, a contractual agreement with an MD. And so the MD would provide that service to them, but even then it would be a much lower, and that is so they can prescribe controlled substances. And so that that contractual agreement with an MD would still be, as far as like cost effective, would still be much cheaper than having an MD psychiatrist on staff. And so they're in the process of doing all of that now. So then that way, so they will have a total of 3 APNs providing that patient care to the patient, or to the, I'm losing words, to the patients.
welcome, Judy. I see your hand there. Just 1 second. I think that we should request them to provide us with a plan of how they're going to change their operations with the retirement of Dr. Abuelita, both a budget amendment and just any sort of a formal. I mean, you're telling us, Amy, but I think they should, as a grant recipient, be notifying us formally and advising us how they continue to provide the same level of service that they've been that they indicated they would provide when they initially requested funds. Yes. Good morning, Judy, and welcome. Julie, can you
Hello,
please
everybody.
Judy Buchanan joined, I think, about 15 minutes ago.
Hannah, in fact, I wanted to follow up on your comments because I was curious, Amy. It's my understanding that Dr. Abuelita is no longer seeing patients, and have they begun to execute the plan? I'm interested in the contractual arrangement with the MD psychiatrist. If that's in place, I like Hannah is suggesting, we need to get some details from them. What is happening in the interim? Is that contract in place, or is it something that they're hoping for? Because we have seen the experience of others in our community thinking they had the contract and were ready to go, and it didn't work out. So I would like to support that request of Hannah's. And then secondly, at one point, in anticipation of maybe Dr. Abuelita's retirement, they were talking about working with a number of primary care physicians in the community. Is that still in place? What is it, a long-term activity that they anticipate, or was that sort of a stopgap and allow us to manage medications with some patients? Or are they going to continue with PCPs, or will they be coming back and being reviewed and evaluated by the APNs?
Sure, I will definitely start that conversation with them and get that formal information to you guys. And I will quickly say to Judy, I'm not aware of Dr. Adelita not seeing patients. He is not retiring until sometime in August. And so
Mhm.
even now with the contractual agreement, that wouldn't need to, they're working on it now, but that doesn't have to be in place until Dr. Adelita retires in August. And I know they're not waiting until August, but yeah,
Right.
just wanted to clarify that he's still there and is till sometime in August.
Well, and I'm aware that at least some patients, if not all patients, were informed of his retirement, and they were
Mhm.
told he was not seeing patients. So it could be that he's not seeing certain types of patients. I don't know what
Right.
that, but I'm curious
Right.
because one of the things we saw in these reports is that the need all over has gone up as people are sort of coming into hopefully a post-pandemic life. We want to make sure that there's a plan in place. I suspect there is, but I'd like to know some of the details. And Amy, while I'm focused on you, thank you very much for the summary reports. I think they are really excellent and will help all of us on the board as well as this committee really understand what is happening from time to time. So thank you for filling in all the details for us.
Yep, no problem. And just to quickly add, Judy, they do so they will have the 2 APNs taking place of Dr. Adelita. They do have one of those APNs in place now. So
Yes.
they vamped up. Yep. Okay. Just wanted to throw that out there.
Okay. No, you're on top of it. Thank you.
Susan,
I changed my mind. I'm good.
Judy, we had just gone, we were, as I had indicated to you, that when you said you'd be a little late, we're doing the quarterly reports now. We'll go back to do the mental health budget discussion, but did you have any comments or questions on the reports at this point?
No, as I said, I really do appreciate the summary report. One of the things we've talked about is, how much information is given to the full board who don't have the luxury of these kind of conversations. And I think that the summary really will help people put a context into what we are trying to serve in our community. So I think that's a very good addition. But I'm fine, Amy, if we want to continue, Hannah, if we want to continue with the reports and then go back to the budget, however you'd like to do it.
I think we had pretty much completed our discussion on that, so I just wanted to give you an opportunity if you had anything to say. And one thing I will say also is I appreciated the numbers showing with the unduplicated, showing how many of those numbers were from previous years. That also is a much better picture of how the organization is working than so that we get clarification that some of those, I mean, I'm not going to quibble over what's considered quote unduplicated if they were already being served the prior year, but I understand that, and that's fine. I like being able to see that. So Corey, did you have something else or?
Yeah, I have one more question about the quarterly reports, but I wanted to weigh in a bit on the adult psychiatry. I've said this before, but I think it bears repeating. So, the Center for Human Services did start working with some clients to get them transitioned to a primary care provider. And they had good success with a small number of clients that were their milder clients. And in this case, milder defined as what type of medication they required. What I learned, I had a conversation with Kim Fryman, who is the primary assessor for Center for Human Services. She's very involved in many things within the agency, but one of the things she does is she does a lot of the intakes. And she explained to me, and this is something that I needed to be made aware of, that primary care physicians are willing to work with some of these more severe clients, but it really depends on what medication they're on, because primary care physicians become, and again, reportedly become uncomfortable when a client is on a medication that is considered to be, a very high-end psychotropic medication, one that requires monitoring of liver functioning, blood tests on a regular basis, that it can have, so kind of the medications that are given to people that have much, much more serious mental illness like schizophrenia and some of those kinds of things. So it's not so much that primary care physicians are not an option and that the center is not already working with some of them. It's that there's that part of the oversight and the ongoing monitoring of some types of medications that primary care physicians apparently do not feel that they are equipped to do. And so I think that made a lot of sense to me. And so I think going forward, we would assume that the center would continue to work with primary care physicians to get those clients that are on lower types of meds, and would also provide some sort of support. I think that's a role we can look at, is are we making sure that in our county that primary care physicians have some sort of support when they take on some of these clients. But I think we also have to be realistic about, where the role of a primary care physician begins and ends in terms of working with some of those really very significant meds and all of the parts that go with that, and all of the case management that also goes with people with those types of very chronic, severe mental illness. I think that case management piece is another thing. So I just wanted to throw that out there, that we have to be knowledgeable about what we're asking. We can't just say, oh, primary care physicians can do it. So,
Judy.
Yeah, and really, thank you, Corey. And that really, I think, speaks to my point, and that is in having worked with and for primary care docs for a long time, I know their reluctance because of the interactions of psychotropics, et cetera. But I think as we look at ourselves as a funder of some of those services, knowing what the CHS plan is going forward, will some of those people that may have been transferred to PCPs who have a heavy reliance on some fairly strong medications, will they be coming back to the center, or will they continue with the primary care? Because as Corey points out, that's going to, if they stay with primary care, that's another additional load of time that is going to be on that primary care office. So I think that's something we need to be aware of. Perhaps we can, our money may be able to be utilized in another way if in fact the primary care people are supporting a bigger percentage of that population.
And I want to make sure, so going back to requesting information from CHS and getting an idea of how you want to go about it, I would suggest that we ask them to submit a new staffing plan, or a staffing plan showing how they intend to work without Dr. Abuelita on staff, and then a revised budget. Is there anything else that we could, I guess, ask them to come and make a presentation to us as a committee. I don't know that we need that. Maybe initially ask for those documents and review them, and then decide if we want any additional information. Does that make sense?
well, we could ask them to talk to us about the primary care physician viability. Just what is the ongoing viability of some patients continuing with them, and what supports are they currently giving primary care physicians, and what ongoing supports do primary care physicians that pick up some clients need, if we're going to continue that in that manner. And that certainly is something that is in the current literature in the field, that certainly is a trend that's happening, that primary care physicians are doing this. But again, we have to be realistic about what's the limitation on that, of what we can ask primary care physicians. But I would like to have a little bit more information about what kind of a relationship have they entered into with primary care physicians.
I agree.
Let me suggest that we have two sorts of issues here. One, we have the grant that we made based on a request that they made and a representation about what they could do. And now they're changing their staffing pretty significantly. I mean, it's a big change to lose that psychiatrist. So I think we as the funder should get information that shows us how they intend to deliver on what they proposed to us when they submitted an application. I think the PCP piece is out there as well, Corey, but I see that as a separate discussion. Unless they say, well, one of the ways we're going to make up for losing Dr. Abuelita is beefing up or creating a better referral program to PCPs. And I think maybe that's where that comes in. If they believe that they can't serve the same numbers. I mean, what I'm hearing Amy say is they intend to hire staff and will continue to serve whatever that number is in a new way. And I guess I just want assurances now that that is in fact what's going to happen, and that, you know, now we're not going to see our cases go down to 400 as a result of this.
Yeah, and
They-
again, I think
It's a
that
line in the first quarter, so I'm assuming that's reflective of, you know, if you look at the other years and quarters and know what discussions have been in terms of their concerns about our level of funding, then I would think 600 is a number we still expect them to be hitting. Obviously, more if we can, but
well, and yeah, and I think that primary care piece really is a part of this conversation because it will impact the dollars that they need from us. You know, it could go up, it could go down, depending upon that primary care relationship. So I think it is a definite critical piece of the discussion.
So can I go ahead and ask my one last, I promise, my one last question on the quarterly report?
sure.
Okay, so it's on page 26 and it's under the problem-solving courts, the objectives. And it's under the second objective. And it says it's outcome 2.2. And it says 50% of the participants will show compliance in drug court and recovery court as evidenced by not receiving any sanctions from the court. And the quarterly one percentage that they hit was 52%. So if I'm getting that right, they're saying that since the outcome was 50% of participants and 52, and they met that at 52%, I'm wanting to make sure I'm interpreting this correctly. So they're saying that only half of 50% showed compliance by not receiving sanctions from the court.
No, they're saying that 52% did not receive sanctions from the court. So the goal was 50%.
That's what I wanted to clarify. Okay.
They're saying the goal was 50%, but they're saying 52% met. And the thing too, just to kind of help bring a little more clarity to that outcome, is that sanctions from the court could be, it doesn't necessarily mean like, it could be extra jail time, or it could be like an assignment, right? Something about whatever. So in that type of program, like receiving some type of sanction, even though it's not, you know, we want all these people to receive sanctions, but receiving some type of sanction is very normal in the process.
Okay.
And so that's why it's 50%, because especially when you have someone new to the program, there's probably going to be this expectation that they may, as they're adjusting, it's a very intense program, as they're adjusting, that there could be quite a few sanctions. So I just wanted to clarify, like, sanctions doesn't necessarily mean, it's a huge spectrum of things, kind of learning experiences, things that could be part of that. So I just wanted to
Thank
clarify and clarify that.
Okay, so they actually exceeded the outcome percentage. So that's
Yep,
good to know.
they,
Thank
yep,
you.
they were
Appreciate
2% over it. Yep.
Okay, appreciate that clarification. Thank you.
They done good on that one.
Mhm.
So just to be clear, so Amy knows what to do. Going back to CHS, I think we would like her to ask them to provide us with any updates or changes to their budget as a result of Dr. Abuelita leaving. I assume there'd be some move from monies and personnel to contract for the contract doctor. And then just a staffing plan, you know, showing, and then I think I think with that also, any adjustments to program operations, for example, do they see doing more referrals out to the PCPs as a result of having, not having Dr. Abuelita available? And I think at this point, we just like them to submit a written report to us. Is that okay with you guys? And then we can take a look at it. And I don't know that necessarily they need to come and make a presentation to us. What feelings okay with just a written report that then obviously we may have some questions to go back to them with.
I'm good with that. Mhm.
Okay, so we'll go backwards now to the mental health budget. And I put this on the agenda because I thank you so much, Corey. I'm sorry, I should have thanked you at the beginning for chairing the meeting last time, but I understand there was some discussions, as we always do, about money. So I thought it might be good to just have a discussion about money on the agenda, more to just start thinking about things. And let me just give you a context and then we'll open it up. You know, last time we did our funding, you know, we found we had about $1.2 million. Let's see, no, 1 million, let's just call it 1.2 million. It's a little less than that shortfall and meeting all the requests for funding at full funding and also all the requests. So we had to carve and shave quite a bit off of that, both not funding some programs, as you know, Corey, you've mentioned the Say No to Drugs, and also asking people who had submitted requests to revise budgets. And you know, this was the 2021 numbers. So we had 1.193623 available to us for grants. And we used $50,000 in fund balance to get that 1.193. We had that whole confusion about the 50,000, but you know, so I guess as it's now budget time for the county and the board and the health department. So many of our discussions have ended, well, you know, we could possibly put more fund balance in there or whatever. So I just thought, you know, now's the time for us as a committee, if we have some thoughts on it or recommendations to make as the health department builds the budget this year, to come up with something. If we feel this warrants putting in additional fund balance to give us more money. We have also set aside $48,000 for the marketing and sustainability. I don't think we really used much of that in 2020. It was there as well. So I think we need to look at either deciding that we have some plans for that, or if we don't, given the needs, I would hate to see that just go back into the pool. So let's now start looking at it, not the month before we're about to end our budget year. The other thing that I think we as a committee should look at is, you know, there's this nice, and everybody wants a piece of it, I'm sure, that the $33 million that's being given to the county through the COVID relief package. And part of that, I asked Amy to attach that memo I had provided to the finance committee with the agreement, just so that we kept it on our radar to make sure that if there are programs or thoughts we have from the health department, in particular from our committee, mental health funding, that we want to get into before the finance committee or whoever needs to review this in terms of deciding how to allocate those dollars, that we work on that. So, and then the final thing, and this is, you know, I think this is all work in progress. We've talked also about community funders and whether we should be working more closely with other community funders to see if there are, you know, economies of scale in terms of use of grant dollars, known problems, shared problems that we can all be kicking in some dollars to solve. So that's sort of my lead into that. Judy, I know you had interest in this and you've had some discussions with folks about it, but you know, I guess my thought would be the budget process. I think, Susan, is the budget open now, or is it, when is, I know policy wise, it's usually June, July, where we start to work.
Correct. I do believe that they've had the departmental heads budget meeting because we did pass the budget policy last month. And so I do believe they've had their initial meetings with administration.
Okay. So now is the time, if we, looking towards our next round of funding and knowing, one, we have decided, we thought it's reasonable to just stay with the existing programs. And that wouldn't require that we fund we had at least that amount in our budget for the upcoming year. But I'm just opening it to discussion and thoughts.
Okay.
Yes, Judy.
Yeah, thank you. I did have some conversations, I think, with all of you and with a few other people. There seem to be several entities, as you mentioned, either seeking grants or providing funds. And I think it's incumbent on us to the extent we can leverage the dollars we know are part of the 553 levy and see if we can't meet the need. We have in the last couple of years had requests for more than was available. And I think we're seeing now as a result of the pandemic, the needs that have really accelerated, and particularly as it related to children and prevention of problems going forward. So I would really encourage us to begin to build the case for dollars that may be above and beyond what the levy dollars are. And to that, I'm beyond my pay grade here in terms of how the levy amount is arrived at, but I would hope that we could communicate our desire that every penny is squeezed out of that levy in some way. Have we done the max with it, the way it's put together? I'm not suggesting we request a levy adjustment or an increase, but just to make sure that all creative thinking has been exercised and what, is there anything more left in there? I think that we have entities within county government, administration, and behavioral health coordinating council, board of health. We need to be looking at what BHCC might be requesting versus what we are, and are we beginning to maybe overlap or duplicate in any of the funding? I don't know the answer to that. But I think post-pandemic, we are certainly aware of the need being greater. So I would encourage us to look at the needs that we're seeing versus from the reports as Amy presents them, and that we probably will hear more from our agencies. Look at that need and the availability of dollars to meet that need in deference to saying, well, we are only going to have this much money. That is a given, yes, but are there some other options? United Way, some grant sharing, some squeezing out anything more from our levy, and doing some more collaboration, because, and then the federal dollars that the needs that the county will be looking at. The first one is support public health response. And that's what we're all about, is responding to the needs of our community when it comes to health. So I would encourage us to look at needs and not be wedded to the fact that we only have this much money. We may conclude several months down the road we only have that much money, but let's make sure that we're looking at the need as well as what is there for us via the levy and what else there might be. And I'd be interested in hearing from Amy as to any discussion she has had on any collaborative efforts with entities within the county, as well as agencies, organizations outside of the county government.
Okay. So thanks, Judy. I was very well prepared for that question. So I do have a lot of collaborations and just a lot of conversations within the community, and just try to keep a pulse on like as far as like needs, what's going on, what's happening. And so I have recently met up more with United Way. And so I'm part of their youth coalition and also their housing coalition. And so that has been very helpful in just getting to learn more about United Way and their role, and especially with kind of their role with like the private money coming from donations. So I know that as far as like United Way, just kind of thinking of like another community funder. I do know as far as United Way, there is a strong interest in the youth. That's one of their main focuses, is just on youth, and they've been very inviting as far as like me bringing more to the table about youth mental health and just being so many challenges right now. They're the group that is struggling the most with mental health. And so I may need some like assistance on exactly what you're asking, Judy, but I do know that, yeah, there's definitely with United Way that interest. And I do know that they would also, I think, be very inviting of having communication from the Board of Health on possible collaborations as far as private and public funding.
Right. Oh, thank you. And I noticed on the United Way website, they refer to the youth center and possible residential as well as follow-up post-hospitalization. And they list their only community partner as the health department. So I would like to really know what is the status of that whole effort, that drop follow-up center, residential center for youth. What's the status of a grant or whatever was being looked at to provide that? Is it really still even viable? Is it likely United Way will in fact roll some of their dollars, and they have several $100,000, I believe, into that? Or we have some very, very strong programming for youth in our embedded schools. And is that something we should be talking with them about? Because we know that's a need, it's there, it's in place. We don't have to wait for someone to develop the program. So that's the kind of information I think might be helpful. Gives us a collaborative effort with the funding source. It sounds like it's looking to do something with youth.
And I would be happy to kind of investigate that more if you guys were interested. And I know Judy and I also noticed that on their website about the youth IOP in the health department. And I think there is some confusion there because that wasn't on behalf of the health department. And so I think just having, and I have had some conversation with United Way about some of this, again, just like huge focus on youth mental health being such a concern right now. And so, yeah, I can definitely kind of investigate that and start connecting, if that would be helpful.
Really, because there could be a statement from our board if they're looking at trying to be in the business of providing a support post-hospitalization or something of that nature. Our embedded school program is so aimed at prevention. And it would seem to me that their interest in youth and making them well and keeping them well certainly is very complementary to the embedded school program.
I'm going to jump in here. Yeah, there is confusion because of that says that on the website with the health, it says the health department. Actually, there is an MOU with the county through BHCC for that. There was an RFP that was put out during COVID to create that adolescent intensive outpatient. It was an not an offshoot, but a collaboration from BHCC on that kind of thing. And so that's what, unfortunately, sometimes they confuse the health department because it's behavioral health or mental health, and BHCC, a lot of people do that. It's not just that.
Oh,
So
no.
that is where that's about, and that's not gone. It still will, still being looked at.
And Susan, is it likely that that RFP will be recirculated, or what? Because we could still go ahead and have some preliminary conversations, I would think, as a board with United Way, because of their interest in youth and our interest in youth. But I don't know where that RFP sits, and if in fact there's anticipation of putting it back out there, there is a likely individual or entity that would respond to it. Those are pieces we don't know. And so the money from United Way could very quickly be utilized. Or if that's sort of still, they're looking at when do we do it? Will we have anyone who wants to do it, etc. Then we have a need right now. And that's why I would encourage us to do some follow-up on this one.
I'll have to follow up on that. There's a BHCC meeting next week.
Right. Thank you. Thanks.
And Corey, I see your hand up, but before you go, can I just jump in here a minute?
Sure.
The way I'm kind of framing this discussion this morning is I think, the health department has the mental health programming that we have done very historically. And this year we said, there's some core services that we think we have to continue to support. And that was the approach we took. We assume that we will need at least the amount of funds that we budgeted last year. We may want to look at whether or not that number vis-a-vis basically maintaining those core services. There are some other pools of money now we're becoming aware of. And I think that's a second discussion of beyond just this little niche that we have with the health department program, but generally, and I think as a part of the overall hope that the community responds, that, we are a part of that. Public health is mental health. That, we engage in more discussions with these other potential funders. And, and I come back to, I don't know whether, Susan, you can address this federal money, whether there's some, I know there was a meeting yesterday at finance, there's some discussion of property today about it. I don't know whether there's thought of identifying how much should go to X, Y, or Z types of programs and fitting it into the budgets over the next few years. It looked like from the agreement that this money, I thought it would be like one time and it's gone, but it looks like, it can be used over till 2026. I mean, with allocations being done by 2024. So we have a nice period of time as a community to figure out the best use of the dollars. So
Yeah, what I know is that the department heads are to be given, or to give administration their requests, I guess, for how that would fit into their, how the different buckets that are allowable for that to be used. And yes, I mean, it's 33 million, but there's only 15 million of it at first. And that's the first tranche of it. And yes, there's a long period of time to expend the money. And so it's going to be very, hopefully very thoughtful. I'm very concerned. It's like, Corey, remember years ago when you said if Bill Gates would drop $1 billion in McLean County to improve mental health, we still wouldn't be able to do it, tomorrow, kind of thing. And it has to be very thoughtful and that kind of thing with everyone, that it's not just the county, it's the city, the town, the school districts. There's a lot of money flowing in on this. And I think that we have to be very thoughtful as to how we go about what we're doing. And I think that that's what administration is going to be looking at on that going forward.
is there any thought to putting together maybe a working group of the school, those people who are providing the services now? As you said, I think it has to be very carefully thought out. This is like a gift, it's manna, So I mean, all
And-
those stakeholders could be involved in some discussions to ensure that we know what's being funded now and how best
Yeah,
to go forward.
I
Yeah.
think that right now we're still having a lot of discussions, just trying to figure out, how to go about even doing this. I mean, really, I mean, if you had a bunch of money dropped in your lap, you don't know what to do with it sometimes. I mean, you do, but you don't. And I know that I read an article about how the schools were going to spend it all on, or not all of it, but a bunch on mental health. So how does that going to impact our embedded school programs and things like that? And so I think that Mark Jontry, is the person to talk to on that one. And I think that he might be doing something at BHCC or talking about that at BHCC because of some of these things, especially going back into in-person schools and mental health and whatnot. So that's all I know right now. I mean, we can all speculate. We can all just come up with lots and lots of ideas as to what we want to do and stuff like that. So
Yeah, Judy and then Corey.
I hear you, Susan. We're all salivating over this amount of money, but the dollar amount that's included in this memo from Camille to Finance Committee, is that amount going to be going directly to McLean County government, or is that what our county is being given for schools, both municipalities? That's only for McLean County government. Okay, very good. And I think the two things, I think we should be building the case right now and documenting for our county admin what we see as the need that now is being delivered to us in these reports from Amy, the need in the schools, that we build the case, and that secondly, we have a conversation with Mr. Jontry as to what the schools are doing, so that we aren't building a case for something that they already intend to try to take on. So I think we need to do two things there.
Corey?
Okay, so I'm just trying to put this into, like, how do we make this actionable? And one of the things but there's a couple things I want to go back and talk about. One is United Way, as I understand it, and I have been in a meeting with them, that there was a group that we talked about this new thing that they're doing, youth programming and daycare. And it's really just like they did with food and housing, they didn't necessarily put money. I mean, they collected some money and put some money into some of these, but what they kind of view their role is right now. And again, I certainly don't want to pretend I know everything about them, but I mean, I think they're seeing themselves as conveners and collaborators. That's the term they're using over and over. They see themselves as conveners and collaborators. And so that doesn't mean that every time they go after an issue, that they see themselves as the funder of that issue. They more see themselves as pulling it all together. And so I feel like this whole youth thing, we do need to somehow interface with them, because if they're seeing themselves as convener and collaborator of youth programming, and that's not necessarily mental health, they're kind of talking about recreational opportunities and just family supports and things like that that are more healthy, positive things, like things that the YMCA, the YWCA, that kind of stuff. So, but I think we need to have an interface with them. And again, one of the things I keep trying to figure out is, BHCC, Susan doing the update on the mental health action plan, pulling together this big picture. Where does this group and the health department, $553, where do we fit into the big picture of, where are we actionable in that big picture, and where? So I mean, it seems to me that we need to piggyback with BHCC, because of if they're creating this big picture mental health, behavioral health plan for the county, and then we are also doing the same. It just seems like there should be some strategic planning that's encompassing all of this. And I think that's what Susan's mental health plan update is kind of is it kind of, Susan, you're also kind of laying out, taking what was already there and just updating the strategic plan for behavioral health going forward, like saying what's already there, but what's also needs to come next. But somehow, where does 553, where do we, and the recommendations of our mental health advisory board, where do we become actionable in the big picture? And so do we, as Hannah said, do we have a working group that's made up of BHCC people and some of us and some other funders, and look at big picture, which would include, you know, American Recovery Plan Act money coming to, for example, the schools, because they are getting a lot of money. Also understand, though, that that money is earmarked. It's very flexible. It can be used very flexibly. I spoke with Mark Jontry, and so they can use it to do infrastructure things. They can use it to do physical plant kinds of things. And so, we can't assume that that money is going to necessarily go to mental health. I do believe that Mark Jontry, I do believe that every one of those districts that gets the money has to create a plan, a written plan. And so we need to get our hands on those written plans when they're done. But we specifically need to get our hands on the part that says what part of that dollars is going for behavioral health. So that's one piece. Then I keep thinking too, then we've got all the money coming in under the recovery-oriented systems of care through Chestnut, and what dollars is coming in for substance use, and how are we interfacing with that? How are we interfacing with Scott Commission? Because Scott Commission used some of their dollars to buy services for families, to get intensive services for families, mental health services for families. And then how are we, you know, and then again, so I'm still trying to figure out, where is the strategic plan? Where do we fit into it? Where do we become actionable? And where do we say, we need to know this from whom? And I don't know whether that's literally sitting down and hammering out a question document, like, what do we need to know from whom? And then how do we get that information? I mean, I almost feel like we need a working group. I mean, this group almost needs to identify how to do that step by step. But I would love to hear what Susan has to say about how does that interface with what BHCC and her update is also doing. And then what do we need to do over and above that or within that?
Can I jump in here just one moment, Susan? I'll give you a chance to answer that, because I think what your questions bring back to me, Corey, and I think it relates to maybe some of our own dollars, is, you know, it would be nice to have a clearinghouse of some kind that said, here are the monies that are coming into the community for behavioral health, who's getting them, you know, so we understand how things are being funded, whether it's insurance reimbursement to grants, to property tax, to sales tax, to anything else out there. And we had one time talked about maybe we could provide or develop something at the health department under the kind of umbrella of the 553 programming to better assist people, and also to put out notices of grants and whatever. Because it seems to me what you're saying is it'd be nice to have a snapshot right now, and maybe BHCC is the proper place to do this, to put a request out saying, can you give us a roadmap now as to who's doing what with what money, since we have, you know, almost $2 million that we, as this health department group, has to allocate every year. It would be helpful to us to know the best use of those dollars so that, you know, the community as a whole has good programming. So I don't know whether it's something down the road we might talk about again, of some sort of a clearinghouse on our website. I don't know. That's an easy thing to say, a big job to do. But anyway, so I don't know, Susan, you had anything you wanted to respond to Corey's questions, or? Yeah, in just a sec, Judy,
No, okay.
I'm going to be providing an update next week at BHCC to the plan update. But yeah, BHCC is the overarching big picture type thing. And almost like a clearinghouse in a way to try to understand all of the different activities that are going on, not necessarily about particular dollars in a way. I mean, like insurance and that kind of thing, which I think that we can get from providers if we ask them for that kind of information. But that is, BHCC is kind of like the overarching kind of clearinghouse on that kind of thing, and activities, not that they're directing or running or owning some of the different activities that are going on, just that they're aware of them so that we can know that there's not overlap or don't create overlap or, that kind of thing. I don't know if that actually answered anybody's questions.
Judy, did you have?
Susan, I agree, and it does, I think, answer part of the question, because I think I was mentioning to Amy at one time, I think we used to have a funders council. Corey, does that ring a bell with you, a funders council locally? But anyway, she's reading.
I'm not sure that I remember a funders council. I
Maybe
mean,
I did that because I thought we needed it, I don't know. But BHCC, if they could become that, not necessarily a clearinghouse, that could be a pretty significant project, but as it relates to behavioral health needs, try to identify entities that are either requesting grant dollars or have had them provided to them, or they have a source of revenue like United Way and like County Admin and others, so that we would know who is planning and what kinds of dollars are being requested. If there's some way to get the BHCC to do that, they might be able to be more successful in getting that information as they, present themselves as part of the larger action plan, as part of the entity that's overseeing all the activity. And as Susan said, not necessarily funding or directing it, but they are trying to keep a focus on that bigger picture, and that bigger picture as relates to dollars available and funding. They would be a natural, I think. I'm not sure how we would propose that to them, but I would support having that conversation with them.
Yeah, I mean, I think one of the big pillars of the mental health action plan was collaboration. And, that can go to the level of understanding where dollars are coming from and not competing for dollars or leveraging dollars together to make sure we get programs. So I agree. The BHCC, it's a great organization. It's been there for years. And I think maybe I'm hearing from our group is we'd almost like to make a formal request of some kind to say, can you begin to develop and gather the data that shows where the dollars are going and coming from, so that as funders, we have a better idea of where the need may be.
And who is making or has recently submitted a grant request. And I think if that document could also be helpful in the confusion that still exists out there, I think, as others have alluded to, between the BHCC and what they're doing with Tricia and those activities, and what Board of Health, behavioral health people are doing. If we sort of begin to lay some of that out, it might help in a way to draw some distinctions. Because that is troublesome for people who are trying to encourage us or work with us if they're not sure, are we duplicating efforts to get the dollars?
Thank you. Those comments are noted.
yeah, I'm wondering if, I'm wondering if for this to become manageable for our piece, if we break it down. I mean, we've got 4 focus areas. We've got youth, we've got adult, we've got recovery courts, and we've got crisis, right? Yeah, crisis system. So I'm wondering if we kind of figure out who else we should be trying to work with for youth, for adults and for recovery courts and for crisis system. And whether there's a need to go deeper in each one, and I'm not sure, I think the crisis system, maybe we start there. We've already learned that we need to know a little bit more from Path about that impact of that new thing that's going to be laid on them July of 22. But, and just if the need is going to keep increasing there and they're going to have a need for more supervision, more paid people, is that a conversation that we need to have more of right now? And any other funders that would join us in supporting the crisis system. Go ahead, Judy. Did you have something you wanted to add to that?
No, as I'm listening, and this is all good stuff, you're talking about the need and responding to the need, which in some respect, I see who's getting dollars or making application or has dollars as separate. Obviously, they must go together, but that need is, in my mind, is separate. I'd rather see us look at that, and then we know what kind of dollars we should be trying.
And then
I may-
go ahead.
Excuse me, Corey. I'm looking at the time, and I'm also seeing that our topic is the budget. I'm just wondering whether we wanted to talk about mental health first aid, just Maureen's report, and we have a couple action items. So I think these are discussions that are good to begin today and to proceed with as we move forward. I think we need to keep our eye on initially, because we're in the budget cycle for the county, to ensure that at least within our domain with the 553, that we are, watch what is budgeted for that within, the needs, that the narrow scope of needs. I agree completely that I think that's a great idea, Corey, of looking in terms of a bigger picture and maybe how that could tie into BHCC.
And maybe us using our 4 focus areas as how we look at who we think we should be talking with within those 4 focus areas. What I'm trying not to do is do parallel to BHCC, and yet that's how we operate right now. We're operating very parallel, not unified. And so I don't know how Susan intends to draw all that together. And again, it's not just Susan's responsibility. That's a lot to lay on one human being. But I mean, how do we do our part without, how do we do our part that we can do? Because again, we're going to have to do this again fairly quickly. We're going to be called into a budget, the RFPs fairly soon. So, and yet try to be united under, BHCC and the mental health update. And yet not be naive that we can wait until BHCC has laid out, has gotten all this in place. So I think we still need to move forward respectfully, if that makes sense.
Susan, yeah, you had your hand up.
Yeah, I'm not going on that, because like I said, I noted all these comments and stuff like that. But when we're talking about going back to the budget issue and the levy and all that kind of thing, because I think that's how we started on this, and the CAFR came out yesterday at finance, and just wanted to let you know that the fund balance in the 112 fund increased by $400,000. So that is something that we can consider if we make recommendations to the full Board of Health.
Okay, great. I saw it was presented, but I didn't see a copy attached to the packet. So thanks for that number. So I think at this point, shall we move on to the mental health first aid? There's a lot of information that we've kind of grappled with this morning on budget issues. I mean, I think where I come down is that, I think we need to look at our own small budget piece as we work through the next couple months, because we'll be basing our grants off of that. The issue of what we do with collaborations with other funders, how some of the money that's being, and remember, the city and town are also receiving these federal dollars. So, there's a lot of money. I heard a program just yesterday talking about, the problem is sometimes you create programs using these dollars, and then as the need that generated the dollars starts to ebb, you've got programs without the need, and that, trying to design them sort of being nimble enough that if you don't need contact tracers all the time, but you have people who can convert to restaurant inspectors, or just an example, this was a health department discussion, but so it is something that takes a lot of care and thought. And, while I understand, Susan, and you seem to be taking the, we're pointing at you, but not, I would hope that as we go through this, that administration does not view this as something that gets bottlenecked up there, that this is really a broader discussion, and the responsibility for kind of taking the sensitivity and time to do that isn't just a matter of throwing a bunch of requests at people and then having 2 or 3 people sort through them. I'd encourage, some sort of a working group, and whether it's by category of need, some way of getting to make sure that there's other people have to take the blame for the decisions as well. But anyway, so I use my prerogative as chair to get on my soapbox. So let's go on and do mental health first aid if we can to get through our agenda. I know, okay, Corey, I see your
I just
hand.
want to throw something out, and I'm gonna throw Judy under the bus. I would like to suggest, and again, you can certainly say no, I would like to suggest that Judy and I, before the next meeting, we come up with a bit of a plan and of taking the 4 focus areas that we've identified, and identify in each of those focus areas who potential partners might be with us, or from whom we might need more information. And so we will come up with a draft, if Judy's willing, we will come up with a draft under 4 different parts, each focus area, and we will say who we should get information from, whether it's about funding or whether it's about what they're doing, or who we should ask questions of and what those questions should be. And we would bring that back to you guys to decide whether you want us to go forward with it. But it will move us off of continually talking about it and having some sort of an action plan and identifying the key partners. And again, just draft, just to get something more concrete in front of us.
And Corey, I didn't know if this is where I turn off my mic or turn it on, but anyway, I don't know. And that's fine. I'd be working with Corey is always a treat and very, very instructive for me. As we look at those 4 focus areas and potential partners, all bets off. We can talk about or list out all partners, whether they be within the county, within our organization, in the county, outside. You were sort of looking at all potential partners. Is that correct, Corey? Okay, thank you.
I'm going to jump in here and say that I think that that's a really huge overlap in what I'm doing with the mental health action plan update. And I've already contacted a lot of, partners that we've had or other, providers in the county. And so I think that that would be kind of a real duplication of a lot of effort.
Okay.
And
So should you should you and I create that to bring back to this group? I mean, what I'm trying to do is just get us so because we always say we need this, we need this, we need this, and then we never nail it and actually get it. And then at the last minute, we're getting a hold of somebody or saying we got to wait or whatever. So I'm just trying to get us in front of it. So that's exactly, Susan, what I've not wanted to do. But I'm trying to get us to what is our little finite, how do we get our piece, get the information that you got flowed to our piece in an actionable way.
Well, let me ask Susan a question. Is this something you could bring to us next month? I mean, I know you're working on the plan and I don't know how much you want to parcel out pieces of it to share, but if you've got it, I mean, and I think, for example, we fund the crisis prevention, and the numbers, like we said, the numbers look fairly stable to our surprise. We know triage has finally, thankfully, gotten to a point where it can operate more fully. Has that program benefited crisis such that we know we're getting some good synergy there? As we decide how much funding should go towards our piece of crisis. Does that make sense? So I don't know if that's the kind of information you've been able to gather that could be useful to us as we look at funding going forward.
Somewhat, yes.
So my suggestion is, could you give us something next month, do you think, Susan, or is that not possible?
I'll talk to you later. And Corey, I'll talk to you later.
Would it be helpful if Judy and I just generated questions that we have? Would it be helpful that we identify questions in each of the 4 funding areas that we want answered? Again, just so that I just get frustrated that we talk in generalities and we never have it nailed. And I'm just trying to get us to a point where we've nailed it to something manageable that can allow us to move forward confidently, that we aren't missing anything. So should Judy and I just work on questions, and then Susan, those questions could be run by you, and you could distill them under your vision, and then that might help too. I don't know, just a thought.
Let me suggest this, Corey, as Susan said, why don't we, she can fill us in, or me in, a little bit more on what she has and what she could present to us. And let's just move forward, kind of know, because it's hard to know right now how that might look. And I would assume that, if you have specific questions, that feel free to address them to me or to Susan, and, so she can better decide whether what she's doing already is going to provide the information that you're looking for. Okay, mental health first aid, I think, was the 3rd thing on the agenda. We received a report from Maureen about what has been happening. I asked for that because it's kind of, I don't know why it got, I do know, I guess, why it's sort of put into a different area. It's not under our behavioral health division of the Board of Health, but I think it's worth us keeping track of what's going on as a committee. So I don't know if there's any questions about Maureen's report. I know she's not on the call, but maybe Amy can answer them. Did you guys hear the report that ISU is doing mental health first aid training now? They have an AmeriCorps volunteer. Apparently he's doing it. There was a nice story on it. So I guess my question would be whether we're all working to, whether we've tied into whatever ISU is doing, but so any questions? Yeah, Corey.
Well, first of all, I just want to make real clear that there's 2 separate, we've already helped pay for, and it's already happened, a training for mental health first aid. And then this is for mental health first aid for youth. So it's making sure the people who will become the trainers will be able to train specifically on knowledge related to youth mental health issues. And I'm sure it's needed, but I am quite frustrated by the numbers of sessions that have been offered and canceled because they didn't have enough takers. And I realized that a lot of that was because COVID forced them into an odd, hybrid situation where some of it was online, some of it was in person, and so it's made it weird. And I'm hoping that when they can get back to fully in person, we'll have more takers that will actually, so that we can, so the offered courses don't get canceled for lack of participants. The thing I almost wish we had time for, and I'm feeling like there's a rush now to offer this dollars, but I'm worried that I would love to check with like school districts about whether they're going to use this, or again, are they going to actually send people to be trained? I would like to see us, if we're going to pay $12,000 towards this, to make sure that we've lined up and again, strategically, we've lined up who's going to get trained. Are we going to ask our bigger districts to make sure they have trained trainers so that they can work it in to their system when schedule wise it makes the most sense, that kind of stuff. So
And I
Uh,
just,
yeah.
I don't know if there was some general discussion on mental health first aid, and you're talking about our action items. So why, if we're ready to do that, why don't we hold off on the specific 12,000? And I think any general discussion on mental health first aid, and then we'll move to the action item where you can bring up, I think those are good points, but let's put those in the context of the request for the money, if you don't mind.
Can I
So-
answer your question real quick, Hannah? As far as like the ISU, and Taylor would probably be able to take, so Taylor just became a mental health first aid instructor. So that's very exciting. And so she probably has even more information than I do. But that coordination, the mental health first aid coordination, is through AHEC, ISU. And so when we're talking about the AmeriCorps member, with ISU, that AmeriCorps member also works at the health department once or twice a week, so that we are in collaboration with that and do share that. So I'm not sure, like the news article, why it didn't mention the Board of Health or McLean County Health Department, but we have that collaboration and relationship. And so the 12,000 that went to the adult mental health first aid, that was in collaboration with AHEC, that is part of ISU. I think I said that correctly, Taylor. And then the quick thing too on like youth mental health first aid, this would be new trainers. So this wouldn't necessarily be taking whoever's trained in regular mental health first aid. And so for youth, it could be completely new trainers. They don't have to have the adult mental health first aid. And it's really looking at the adolescents. What is the difference between normal adolescence and kind of being a little wonky, and what is mental illness in youth? And so, and then with Taylor too, like Corey, to kind of talk about what you were saying, there's already some outreach about like getting mental health first aid. So we have a pretty good relationship with Heartland Head Start, and they've already asked if Taylor could assist in training their staff on mental health first aid. So that could be like one of those places too, where like with youth mental health first aid, especially with them dealing with little kiddos, could be something they're interested in. So we are partnering with Marine and trying to help expand the program. And it does look like there's some bright, shiny points coming our way. And even though there has been some of the cancellations, which I think is a lot to do with the pandemic, but just wanted to quickly share that.
Judy?
Yeah, thank you. Yeah, I noticed that District 87 is working on it, and Diana Wolf is involved. So that's probably good. We have a strong ally there. The ownership of mental health first aid, is it owned by the health department?
So I've talked to Maureen about this, and I don't know if I would necessarily use the word ownership. So Maureen Sollers is the coordinator, but they look at it, so she does a lot as far as like the logistical piece and works with the AmeriCorps member, and then has an OSS that helps with the logistical piece, like collecting money, setting up trainings. But I don't think I would necessarily use like the word owner, but definitely a very big piece of that mental health first aid collective. Would you?
It's our program, correct? I mean, it's
Well, there's a consortium that puts it together, and Maureen's one of the members, but it's like the hospitals, Chestnut. I'm trying to think if there who else, Amy? I think there's one other.
Well, there's different players throughout the community, and the hospital definitely has a strong part in it, ISU, AHAC, but Maureen is the coordinator.
Okay. But I mean, there is this collective.
there. Okay,
There's
very
a
good.
collective that meets to design, to figure out when they should hold the trainings and all of that. And that's my other concern is I'm not sure that when they set up the trainings, they always really think strategically about who their target audience might be and whether the date they select is going to work best for that particular target audience, because they sometimes set up ones for youth, like 2 days before the last day of school. That's never when a staff member could come and attend that. So those kinds of things, I think we need to think, I think sometimes we don't think strategically about who the target audience for different things are. So I
Is part of that, does Maureen need some additional support? Because she probably then takes the lead with some of those ideas and tries to develop them. I'm wondering if she needs support. And then Amy, after you answer that, can you talk a little bit about how mental health first aid is promoted?
Oh, okay. And so I'm leaning on Taylor to help me with this too, because she has definitely became the kind of our person in the program. So Judy, yes. So we're looking at mental health first aid, and we have really been more collaborative within the last few months with Maureen. And so our hope is really, because it's a great thing to get in the community, and is so much needed right now because of people's challenges with mental health. And so Taylor and I have talked about really kind of helping in that expansion and making that more of a priority and being a collaborative partner with mental health first aid. So as far as the behavioral health program with Maureen, and so with Taylor being trained as a mental health first aid instructor, and then also when I get a new OSS, they will be able to assist in doing some clerical work with mental health first aid. So internally, we are looking at how to really kind of help expand it and have that behavioral health piece in it. And we're even looking at, there was a grant last year, the very beginning of this year, that we tried to apply for, and it was through SAMHSA, and it ended up just being really, really complicated. And we had a very short deadline by the time we saw it and got approval to apply for it, that we had to step away because we couldn't get it in. But actually, Taylor, Maureen, and myself, we are working together now on if we apply for this grant, if it's a reoccurring grant. And so if we apply for this grant, if it comes up again this winter, we can hopefully actually get it in, and it will go through. But even if it doesn't, we are still some of these plans of expansion, what can we do with what we have now internally? And so I think right now, as far as that expansion, we have the capacity between the behavioral health program and Maureen, overall collective, to kind of see where it goes with that. But Judy, as far as the promotion of mental health first aid, I know that would definitely be a Maureen question, and I don't know how to answer that. Do you know how to answer that, Taylor?
I not officially, but I do know it's on our website, and I do believe it's sent out on distribution lists of Marines contacts. And then I'm sure of the collaboration of all different trainers and agencies, they promote it as well. But we would need confirmation through Marine, but those are just the avenues that I know of, that I've seen.
I thank you, Taylor. And I know that both hospitals, when they have different newsletters and flyers go out, it's always in there. But I'm just wondering, particularly right now, as Amy said, we know it's needed even more. If we shouldn't ramp up again, one of the things we find out is we've got good things going, but people don't know about them or how to access them. So maybe we should really ramp that up. And I would appreciate knowing, what's done now and how perhaps we could ramp it up.
And I will say, I know they create they do a yearly schedule of all the trainings, and get that's again what's posted on people's websites, so people can know in advance when to sign up. So I think that's great, but I agree that we could market it much more fully. And I think again we could target groups that, like churches that and any place where there's families like YMCA, YWCA, child daycare centers, all of that stuff, we could be getting out there to talk about the youth one in particular, and then obviously the regular one. But, I think about the groups that in Ending the Silence in our quarterly report, they indicated groups that are asking for ending the silence. I'm thinking those same groups would probably, if they might be well interested in mental health first aid as well, or that would be a nice companion piece. So I think, again, I don't know if that collaborative, the mental health first aid collaborative, and maybe with you, Taylor, being part of that, now you could kind of drive that discussion of, let's identify, target groups to really market to, and then let's, get that out there in a timely fashion. And then, and I do think one of the things they talked about doing is now when people sign up, there's going to be, they won't get a refund after a certain date. And I think that's a good idea, because, it seems like there's way too many people that sign up and then cancel and whatever. So I'm sure the consortium can work out all those details.
Yeah, I would encourage that and support that.
Well, I'm not clear who the consortium are.
There's
Is it a group that meets regularly and establishes policies, procedures, and promotions, et cetera? I'm suspecting not, but I don't know that.
Isn't
I know
it
that
So,
group that was formed when this was a new idea and initially put out there, but is that group still meeting on any regular basis to set policy? And okay, I'm seeing nodding.
Taylor, can you speak to what that collaborative, like just some of the frequency of how often they meet? And then it's also through National Council for Wellness. It used to be National Council for Behavioral Health, or National Council for, they changed the
mental
name.
well-being.
Thank you, Taylor. National Council for Mental Well-Being sets some of the policy also and procedural, as far as like what has to be done. But Taylor, can you provide some more information as far as the when the collective meets and like the purpose of that?
Yeah, so I've only gone to a couple meetings, but the collective are like different, the trainers, those that are trained to be instructors from different agencies, and they come together, talk about like the schedule, thing, like the plan for mental health first aid, who's doing what is needed. And from my understanding, it's quarterly.
I'm wondering if, since we now have a public affairs coordinator within the health department, who's got good experience on how to really push things out there, this might be a chance. Particularly, everyone's talking now about the kids, about the toll on our mental health. It's the top topic on all news programs. Let's sit down with Mary Ann, some of you folks, and try to come up with a plan, a marketing plan, if you will, because it is phenomenal, and it's well worth the time and the money.
Awesome idea, Judy. That makes me feel much better about supporting this, because I worry about ending the silence too, because there's a demand for that. And I'm just trying to figure out how to juxtapose, those two things, because they're both wonderful.
Well, and that was part of the work you and I started, Corey, after the Behavioral Health Advisory Board said, you guys are doing a lot of good work here, but I don't know who all knows about it or how to access it. So I think we need to keep that in mind, particularly now that we have a professional with us in a public affairs position.
Yeah, that's a great idea, Judy. And I also think, what we're seeing with what Amy and Taylor are working on, you asked the question about the ownership of the program, and people may meet quarterly, but, I think there does need to be some ownership, some centralized, and that's not for us to determine within the health department. I mean, but I kind of encourage you guys to continue to figure out ways to bring it into one department, or at least regularly working together. So,
and should it not be
the ISU program didn't sound that there was no mention of the health department at all. It was like, this is ISU's program, which is fine. But now hearing from you today that in fact that a volunteer really works with us and the scheduling and a lot of the work behind it. is done through the health department.
I'm sorry. I think that mentioning our role is very important. And, you know, again, trying to help the community understand where the health department and their tax dollars that they approved are going. So I think anytime we can mention those programs where we've become a central, yeah, we have lots of partners, but if Maureen is a coordinator, we basically, we're kind of the quasi owner of this. And we should be letting people know that.
I think it just helps with feeling safety too, because if it's from public health, it's from the health department. And hopefully we have that relationship with the community where they know like it's something good for them to attend and it's a safe place for them.
And there'll be no shots given, right? So,
And then that also kind of, that also would be good on some kind of ownership. I agree with Hannah, that somebody kind of needs to have an ownership, and if they meet quarterly and they're keeping track of this kind of thing, and I know I've talked to Maureen about numbers and things like that, to be also, that would be funneled up to BHCC, just to have an awareness of what is going on in the community in that aspect of it, because on BHCC, we do have members who represent large companies in this community. And, you know, that's always the outreach that we need to make to provide those courses to that population. You know, if the companies want to have some kind of training at their business, you know, kind of thing. And so that's why it's important to keep funneling up just the information. Like I said, BHCC doesn't own it, somebody else owns it, you know, kind of thing. If the health department wants to own it or whatever, you know, that is the kind of information that needs to be continually channeled, so that there isn't any overlap, any duplication, any, you know, lack of coordination and, you know, collaboration on some of these things.
No, again, yep. The action item is for the youth trainers instruction course. Is
Yeah, I
that,
was gonna say, if we're done with the general discussion, we have two action items. One is approval of the minutes from the April 28th meeting. So we go ahead and did I hear a motion to approve those minutes?
so
Judy,
moved. Yep.
Cory, second. All those in favor, I guess we have to take a roll call on this.
Tina Eisner,
I wasn't at the meeting, so I will abstain.
okay, Corey Tello,
Yes.
Susan Schaefer,
Yes.
and Judy Buchanan.
Yes.
All right, great. So now we're to our action item. Let me read it. This is approved funding of $12,000 for funds for youth mental health first aid trainers instruction course. So can we get a motion and a second to get it on the floor for discussion?
So moved.
Judy moves, Susan second. Any discussion? I think Corey, you had some points you made earlier. Do you want to?
Yeah, I would say we should go ahead with it, but I would like to have some caveats, I guess. And one would be that we need the money to be given with the idea that there will be outreach to different groups who should have a trainer on site if possible. So in other words, let's think strategically about what youth organizations are large enough that it would make sense to at least invite them to perhaps have someone within their organization to be trained. And so, you know, and maybe that's already happening. It probably is, but just that we would get some feedback about that there's a strategic effort to identify who ought to be contacted about becoming a trainer. And then the second part of that is that there is kind of a strategic plan, again, about how to market this. I think Judy's point was excellent, that we want that group to meet with our public affairs coordinator to identify how to, once we have sufficient trainers, because I think that's one of the reasons why through COVID, they couldn't push it because it was so weird with the hybrid situation. But now that they'll have enough mental health first aid trainers, that the regular mental health first aid trainers that just got trained, and then the new batch of youth, then let's get the public health affairs person really out there marketing it deeply to like the business that Susan just talked about. But I would love to have that kind of attached to that funding if we can do that.
Judy, did you have a comment?
No, I have a procedure. And I think we can, if we're offering to fund, there are some conditions, and I think we can do that. We're asked to approve this today. Does it not need to be approved then by the entire board? And what is the source of, where is the $12,000 coming from in the budget?
I believe, yes, the Board of Health would approve it. I mean, let's
So it's
just,
our
we
recommendation.
would bring it to the Board of Health for approval. And there are funds budgeted. There's $5,000 for mental health first aid training in the
Okay.
budget. I don't know if that money has been used. There is the $48,000 that is it's called non-contractual, but it is the marketing and sustainability dollars. So I guess we'd have to leave it to Jackie to figure out how we might have to. I mean, I think that non-contractual, those dollars could be used for this purpose. There's already 5,000 dedicated for materials for mental health first aid, but I think, assuming that Jackie and Jessica agree, I think the 12,000 could come out of that non-contractual line.
I think the 5,000 is being used for like books. And that's something that's in there yearly in the budget, is being used for like the course materials. And then I think that when we thought about putting together the request to come before you guys, and then knowing that then like the Board of Health would do the final approval, we were thinking also about the money that was earmarked for like the marketing, being able to come out of that. But
We
No.
bought, if you remember when we approved it to do the mental health first aid trainers, we approved seats. We also purchased seats for participants and which we have not used because so many of the trainings have been canceled. So they should be sitting on some money of ours already for seats of trainers. So, I mean, I think, yeah.
Corey, remember, that was last year, that was the 2020 budget.
Oh, okay.
So if that money was not used, it just wasn't used. It went back, and that's where it is potentially in the fund balance.
Okay.
But now we're dealing with our 2021 budget, and there is $48,000 budgeted in that non-contractual line. So I believe that's where we would draw from to fund this request. And we would take it to the Board of Health. I don't think it has to go all the way to the county board, but let others determine.
It didn't, the first round didn't, I'm quite certain.
I mean, it's more or less just,
So are you saying, Hannah, that the 5,000, we don't have anything budgeted for books? Now, Amy, did you say we do have things budgeted for books and other
5,000.
costs? And could this instructor program qualify to be taken from that line, the cost of it?
We might deplete it because we don't have sufficient funds in that line. I mean, I don't know.
Well,
I guess I would leave it to the Jackie and Jessica and Amy and others to determine where best budget-wise it makes sense to spend the money. It's there. It's in that non-contractual. If they feel it's appropriate to take the 5,000 for books and materials and another piece another place.
And I think it does have to go to the county board just for a budget amendment, even though the money's there. Samantha, could you maybe weigh in on that? But I don't think it wouldn't be an issue. It would just be a transfer, I believe, on that. But just from one line to another line, and I don't think it would be a problem. And I think that,
I guess
but eventually it's gonna go.
the question I would have is
Yeah.
whether this would qualify as non-contractual anyway, and we would not have to amend the budget. So, I mean, it's a general category of expenditures called non-contractual. I don't know. Our auditor would probably have to weigh in on that. But
I
yeah,
don't know if you need me to say anything, but I think Susan's right. If it does, it will, but I don't know the answer. So you're right, Hannah, too. If it doesn't, then it won't. So we have to figure that question out first.
yeah, yeah. So,
Okay.
Am I correct that we're just being asked right now for $12,000, though? That was the ask, right? Just $12,000. So I think we just stick with, let's just go with the $12,000 right now. Does that make sense?
you want to attach a condition to that, Corey, and I would ask you to put that into your own words if you want to amend the motion to approve it. With
About the two things I brought up, the two previous ones. Okay, so yes, I would support the motion with the addition that we ask for an action plan by the collaborative that identifies that demonstrates that they have reached out to entities that have large youth contact to get trainers within those larger youth serving organizations. And then two, that we ask the collaborative that after the trainers are ready to go, that they work with the health department public affairs coordinator to create a marketing plan. And I guess we should say for that, for all mental health first aid, but particularly for youth.
Right.
And that we ask for this in writing back to us. Does that make sense? That we see these action plans in writing, and they can be bullet points, but just that we know they've outlined the steps they're going to take.
I will definitely take this to Maureen and just to make sure we know the training of the youth mental health first aid instructors is, I think, the end of August. Just so we know there's a couple of months there before they have to be trained.
Okay.
which gives them plenty of time to address Corey's concerns. I think, Judy, you made the original motion. Do you want to just withdraw your motion and allow Corey's to go forward?
Yeah, or can I amend? Yeah, that's fine. Whatever. I'll
And then-
withdraw, make it again.
Okay, or we could just
Corey
do
said,
Corey's amended motion, and then you want to second her amended?
you want me
Alright.
to?
Yes, please.
Second, got it.
So I believe at this point we have on the pending a motion to approve the $12,000 grant request with the two conditions. One, that we are provided with a plan that identifies the organizations to which training will be provided that should, I'm trying to say, this right, that should show a large number of impacted youth or potential youth. And that secondly, that that they work with the public affairs coordinator for the health department or to ensure adequate marketing and good marketing for the program. Kind of sums it up. Any other discussion? We ready for a vote? Okay, you gonna do a roll call, Amy?
Sure. Hannah Eisner,
Yes.
Corey Tello,
Yes.
Susan Schaefer,
Yes.
Judy Buchanan.
Yes.
All right, so thank you for all the time and good discussion and whatever. This is I always feel like these meetings could get a lot done. Corey, you mentioned at the very beginning, you had put together some comments on the template. That was not on the agenda, and my apologies if it was intended to be. I would suggest that that's the kind of thing that maybe we give Amy, and I know Samantha, I'm going to bring you in on this. I think reading the minutes of last meeting, you had said if we intended to go with just a renewal, that we may need to be attentive to how we word those requests for funding. So I guess we're getting to that point where we need to start putting those together. So I would think comments could go to Amy, and I'm sure she'll be working with Samantha on that. Yeah, Judy.
Just very quickly, my my suggestion that we work with Mary Ann Manco was really intended that the Maureen Solers and Amy and Taylor as a group talk to her about mental health first aid and promotion overall, not just exclusively. It would include youth, but that she help us get the entire purpose and program out there to the general public.
Yeah.
Okay, thank you.
Samantha, you came on, so did you have a?
No, I just,
Okay.
I'll work with Amy.
Yep,
Okay.
Samantha, this was, just to quickly clarify, this was with like the RFP, they are looking at wanting to continue funding with the current agencies or the current programs they're funding now. And so with the RFP, their question was, can we just send that out to those agencies saying, if you are interested in receiving money for 2022, here's the RFP, here's how you would do this renewal application and budget, or do we have to send it out publicly, the RFP publicly, but stating in that RFP that the money is only available to those that are currently being funded. So it was a logistical question of how does that RFP go out?
Yeah.
Go ahead, Samantha, I'm sorry.
I think that you and me, Amy, should work a little closer on this to make those details, because my first inclination is that it has to be public, but there might be some exception to that, especially if we're only limiting it to a certain number of people or agencies. So I think you and I should work a little bit closer before that goes out.
Thanks. I think that's a great idea. So.
And really all I did on the draft I did was I just took, Amy had all those questions and I just tried to group them under categorical headings. So it's easier to find information, but also so we're eliminating redundancies, because I noticed last year, I think we all remember there were so many times when they said the same thing over and over again about evidence-based or whatever. So I tried to put all, so just answer one time about evidence-based and just answer one time about trauma-informed care. But I mostly took Amy's questions and just reorganized them a bit. So
Yeah.
this was just a very quick stab. So we need to keep going. But again, what I'm still trying to figure out is like, are we saying already for this coming year, we would do a modified renew? So we would have two types of applications. We would have one that would go out for the general, at large, and then we would have a second type of renewal RFP that would go to existing people we're already funding. And so we would need to have two different RFP applications. Is that correct?
Let me suggest something, Corey. My take from the meeting we had last month was that this committee felt that the agencies receiving the funding this year were providing core services, and that there was sort of a consensus that rather than put it out and pretend like we have adequate funds to fund lots of different programs, we really don't, and that we wanted to, for the tax levy dollars, basically say we are offering a renewal to those who received money last year. And I think that's what we need Samantha to work on us with, is how do we do that properly? If there are other monies out there, either the federal monies or something else, and I think that's a different matter. And we're kind of mixing apples and oranges, I think, at this point. And I think our focus right now, I would suggest, should just be on the known dollars that we have, our decision that with the known dollars and limited dollars we know we have, we want to just pursue renewals with core service providers. As we look at what dollars may become available, there may be other types of things that would go out, and that might, in my mind, be a a separate process, which might involve an RFP in what we've done in the past. Does that make sense?
It makes sense, except we did talk about if schools are getting all this money through the American Rescue Plan, and certainly we need to find that out. I mean, I don't want to pretend, I do not want to take anything away from the schools, but if we learn that they have money to direct to mental health services, then, that might change how much we want to give to schools, or maybe we say, no, we continue to fund the number we've always done, knowing that we've always said, there's a million schools out, there's a lot of schools out there that don't have an embedded therapist. So do we just continue to do our 100,000, which we've targeted, and just leave it at that, and then not worry about that? That's what I'm trying to figure out is, are we going to try to tease out any of the funding before we say, yes, we're just going to automatically renew?
Well, I think that's a question that remains open. I mean, we could do it either by putting it out there with the current programs what we identify as funding priorities and the dollar amounts that we put in them are two different things. I mean, I would think if we're putting it out saying, you who are currently receiving funding, please submit a request for funding of X dollars, as we had to do last year. And we're going to have to deal with what those requests are and what we actually have available to fund. And I mean, there's no real super clean way to do it, I don't think, unless we want to, before we even put it out there, carve embedded schools out of this and say we're talking about crisis, psych, those other programs, and that school programs we're leaving out on the table until we know more about what the schools are getting. But, I think let's get Samantha's weigh in on how we can do this the right way. And there are going to be options, I hope, or think, and then move forward with that. I know we have to keep moving ahead because we have to go through this and decide dollars, but it's a moving target because we don't know the dollars that are coming in from other sources. So does that work for us for this month? I mean, maybe next month we'll have a better idea of, maybe we can, Samantha, I don't want to put you on the spot. I don't know if you would, given I'm sure you have nothing else you're doing, but whether for our meeting next month, you and Amy will have talked and we'll have some sort of a proposed, this is how we'll move forward, or options to do.
So, yeah, definitely. And typically with other committees that I help, I usually will send out an email with some of my findings, if that is okay with you, or if you prefer for me to take up time in the meeting to give you an oral presentation, I can do it that way.
Whatever's easiest for you.
Okay, we'll probably write it down then.
Yeah, that's fine. That's always good to have a reference. So
And
I
you're
think
going to find out about the waiting list thing too, right, Sam? You're going to find out about the liability connected with any kind of a waiting list for agencies.
Yes, and Corey, if it's okay, I was going to call you and get a little bit more details to flesh out your question, because I have my inclination at this point is that if these agencies qualify under the Tort Immunity Act, that might change things because they are funded, at least in part, from a public entity. So we'll talk in more detail about that. But if you don't mind, I was going to call you.
okay, and just so that Sam, you're clear, I think what we're asking is how would we proceed if we just said everybody receiving funding now, we'd just like to open it up for them to apply for renewals. And that would be all the programs that are currently receiving funds, which would include the embedded schools. The other option would be, can we just do it as to all but the embedded schools because of not knowing how the funding that may come into them will impact our need to continue to put that money towards those programs. Is that? And then the third would be if there's additional monies, or we've done what we've called pilot programs before. I guess I would say it's similar to that if we think there's, with the Rescue Act money coming in, maybe there's a pilot program out there that, we would look at in conjunction with other agencies potentially. I mean, that's just a whole new creative process that might involve an RFP from our end.
And do we do something about the Project Oz, Too Good for Drugs? Do we want to in any way revisit that? I mean, we had a narrative from them that outlined some things, and not today, but I mean, is that something we want to still put into the agenda next time to revisit the Project Oz, Too Good for Drugs issue?
I'm not sure what they're asking. Are they asking to be funded this year? Or are they trying to submit requests for funding for next year? And I guess my feeling is it was a difficult decision, and there was never any question in our mind that this is a program that's a worthy program, but we went through that heartache of deciding which programs we could still fund. I don't see where we have a way of entertaining a request from them right now for money. I don't know what the other committee members feel like, so I guess I need to be more clear what they're asking for. But there's certainly a danger of opening ourselves up to people coming back to us after our decisions are made to say, well, now would you fund me? I mean, any organization could do that.
I'm just trying to figure out, how do we assess the need for that? And is that something that, again, we ask Mark Jontry to assess, what the districts, what he hears from the districts as far as what he sees as a need to deal with substance use prevention. And again, remembering that that isn't just substance use prevention, it's also teaching kids just general life skills, coping skills, social emotional learning skills. So whether, it would be hard for me to know how to go forward if we didn't get the people who used them in the past, how concerned they are to have that discontinue, because it will completely end. Amy, it's done at the end of the school year, correct?
So the contract goes through June 30th. And so this, as far as the schools that were being funded by the Board of Health for that curriculum, because they do receive state funding. And so they're using that state funding for certain schools, but that wouldn't cover all of the schools. And I think, Hannah, too, like some of this is from the discussion last meeting where there was that 16,000 for the first 6 months of this year. And the board was thinking, well, since they were funded for that 6 months, does that mean like they would be part of the ones that would be included in that specific RFP for next year? But then obviously like the 16,000 wouldn't be enough. And so would it be more money? And so I think that that's where, like, since they were funded 6 months this year, does that go into, you got funded in 21, do you want to do this renewal application for 22? I think was where some of the discussion was last month.
And I will just jump in. The schools that were funded for that were 5th through 8th grade students attending Bloomington Junior High, Chittix Junior High, which is obviously Unit 5, Ridgeview Junior High, and Lexington Junior High. So it is a good range across the county. And it was for those 4 buildings. So whether, I don't know, do we get information from those 4 buildings about, what happens if they don't have those services? Is that appropriate for us to do?
So I wasn't there, I apologize. So we fund these on a calendar year basis, and I know we've gone back and forth, or, we changed this, but we track the county count. Obviously, things that go in the schools, our funds cut across school years. So they should be using 2021 dollars now. Now, if they carried over money, maybe they did to continue through the end of the academic school year. So, I mean, the 16,000 that they would have used from January 1 to now. I mean, I know we talked about whether they could sort of use their award between NAMI and the, I mean, that we agreed that they didn't have to segregate by those programs. So So I guess my point is we gave Project Oz dollars for 21. And I don't know where talking about additional dollars in 21 fits into how we do business. And I'm being kind of hard-nosed about this, but somebody has to be. I mean, I don't see how we open it up and say, now we're going to give you additional money during this funding year for us, our fiscal year. That's a dangerous precedent, in my opinion, because every other agency is going to come back and say, oh, well, then open it up because we need money, more money too. I mean, you know, Corey, you always yell at me. All of these programs are great programs. They're all needed, you know, so I guess I'm a little lost. If maybe, Amy, if you can bring back or give us some track the dollars so we understand what we're talking about, but I'm a little lost on where
Well,
we're
I
supposed.
think that maybe this is something that if the schools are interested in and really would like to have, that is addressing behavioral health when it comes to the American Rescue Act money that they're getting. That, you know, if they want to have that for at least the beginning of this next school year, to at least line up with our calendar year, even though we don't have that as a core priority. I mean, one that we're a renewal right now because it's really, it wouldn't be a renewal, I don't think, in the way we were talking about it. But as we are the payer of last resort, and we've always, you know, said that with our tax dollars, that we are the payer of last resort. Is this something that can be approached to the schools and have them funded if they felt that they really needed that program with the extra money that they are going to be getting?
And let me make a suggestion here. I feel like this discussion is getting much more in depth about a topic that was not on the agenda. So we're not making decisions. And I think that this could possibly become an agenda item next month. It's been hanging out there, I know, and we're getting documents without really any purpose that's clear. So
It would be great to have it as an agenda item.
I guess it, you know, or not, but I think we're probably getting too far into it for this meeting. So, I mean, if Amy, you want to send us out something that kind of clarifies what this is all about, that might be helpful. But, and you know, I think whenever we made decisions about we can't fund the program, our hope is that that program will seek out other sources of funding. We've had a lot of discussion about how there's money out there that supports similar services, and as long as we continue funding, you know, when there isn't a need. But now we may be sending a message: you got to find those other pots of money.
Yep, I can reach out and just say, yeah, what would, yeah, I'll come up.
I mean, I think it would be good to find out if they have spoken. I mean, they have great relationships with the schools. And so it would be good to know if they've had conversations with the schools about possibly being funded under the rescue plan, the American Rescue Plan, that dollars. It would be good to know whether they've begun to have those conversations.
Okay, I see we're only 24 minutes past our stated time. Is there any other top information for the cause? Again, appreciate everybody's time this morning. It's always great. And I don't know, I guess the question I have, I don't know which direction we're going in terms of in-person meetings by next month, whether there will be a decision made that these things will convert. So I guess we'll find that out.
I did put a message in the chat box. We keep saying next month, but our meeting is actually June 24th. Or
Oh, we delayed. Okay.
just yeah, we're just it. Yeah, so we actually, if we go back to the schedule, we actually meet twice in June. So today and then June 24th. So just
What do you think, committee? Do you want to meet that soon, or do you want to?
You know, I think it's really important that we start pulling all this together. So I think it's great we're smart enough to schedule 2 in June, because there are so many threads that are hanging, and I would love to, sew those together and have something more unified moving forward. And if once Susan has, and I think once Susan is ready to share some things, that'll help us create our next steps too. And I think she's going to be ready for that. God bless her.
So June 25th is what I have, a Friday morning.
Yep, Friday, June 25th.
And thank you all for changing the meeting this month for me. I appreciate it. Okay, do I have a motion, move to adjourn? All right, Susan, second. All right, and I don't think we have to vote on that. So everybody go out and enjoy this beautiful day. Thank you for all the good discussion.